Have you ever heard that kidney stones are simply caused by eating too much calcium? Or perhaps you were told to avoid dairy completely, drink lemon water, or stop eating certain foods because they supposedly cause stones. Some of these ideas contain a small piece of truth. Others can lead you in the wrong direction. The important thing is this: kidney stones do not all form for the same reason. Your prevention plan depends partly on what type of stone you form and why your urine allows crystals to develop. I'm Ross, and today we're going to separate some of the most common kidney stone prevention myths from what doctors and current medical evidence actually support. If you want clear, practical health information without unnecessary confusion, subscribe and stay with me. Let's start with one of the most common misunderstandings. If you've had a kidney stone, you should stop eating calcium. This sounds logical because calcium is part of many kidney stones, especially calcium oxalate stones. But your body does something more complicated. When you eat calcium with food, calcium inside your digestive tract binds to oxalate. Oxalate is a natural substance found in many foods. When calcium and oxalate bind in your intestine, less oxalate gets absorbed into your bloodstream and eventually reaches your urine. Why does this matter? Because high levels of oxalate in urine increase the chance of calcium oxalate crystals forming. So for many people who form calcium oxalate stones, getting an appropriate amount of dietary calcium is part of prevention. The goal is not to remove calcium from your diet. The goal is to have an appropriate calcium intake and avoid excessive calcium restriction unless your doctor gives you a specific reason. Calcium from normal food sources is different from taking calcium supplements without medical guidance. If you have recurrent stones, discuss supplements with your doctor rather than making changes based only on the fact that your previous stone contained calcium. Now let's talk about water. You might think drinking more water only matters when you feel thirsty, but your kidneys continuously filter your blood and produce urine. If you do not drink enough fluid, your urine becomes more concentrated. Think about what happens when you mix a small amount of sugar into a large glass of water compared with a small glass. The same amount becomes much more concentrated in the smaller volume. Kidney stone formation follows a similar principle. When urine becomes concentrated, substances such as calcium, oxalate, uric acid, and other compounds have a greater opportunity to reach concentrations where crystals form. This is why fluid intake is one of the most important parts of kidney stone prevention. And there is an important detail here. The goal is not simply to drink a certain number of glasses because someone online gave you a fixed number. Doctors often focus on urine volume when assessing recurrent stone risk. Your fluid needs depend on factors such as climate, activity, diet, and how much fluid you lose through sweating. If you live somewhere hot or exercise heavily, you might need more fluid than someone sitting indoors in a cooler environment. A practical approach is to drink regularly throughout the day rather than waiting until you become extremely thirsty. Now, what about lemon water? Lemon water has become popular as a kidney stone remedy. There is a scientific reason people talk about citrus. Citrus fruits contain citrate. Citrate is a substance found naturally in urine that helps reduce the formation of certain calcium-containing crystals. So the idea is not completely unfounded. But lemon water is not a universal treatment for kidney stones. The amount of citrate you obtain depends on the drink, the amount consumed, and your individual urine chemistry. Some people with recurrent stones have low urinary citrate, a condition called hypocitraturia. In selected patients, doctors use specific citrate treatments as part of prevention. For other people, the main issue might be low urine volume, high urinary calcium, high oxalate, high uric acid, or another factor. So drinking lemon water might be a reasonable part of your fluid intake, but it should not replace proper evaluation when stones keep returning. Another common belief is that you should avoid all high oxalate foods. Oxalate does matter for calcium oxalate stones. Foods such as spinach, some nuts, certain teas, and other plant foods contain oxalate. But completely eliminating every food containing oxalate is usually unnecessary and difficult to maintain. The more useful question is why oxalate is reaching your urine in high amounts. Remember the calcium connection. Dietary calcium consumed with meals helps bind oxalate in the digestive tract. So someone with calcium oxalate stones might benefit from eating an appropriate amount of calcium with meals, rather than removing calcium completely. Doctors also consider the overall dietary pattern, fluid intake, sodium intake, and other urine measurements before recommending major restrictions. Now let's talk about salt. Some people assume salt has nothing to do with kidney stones, but sodium affects how much calcium your kidneys excrete into your urine. A high sodium diet can increase urinary calcium in some people. More urinary calcium means more opportunity for calcium-containing crystals to form, especially when other risk factors are present. You do not need to remove salt completely. Instead, pay attention to major sources of sodium, especially highly processed foods, packaged meals, salty snacks, and processed meats. If you have recurrent kidney stones, reducing excessive sodium intake is often more useful than focusing on one isolated food. Another common myth is that protein causes all kidney stones. Protein is not simply a kidney stone food. Your body needs protein for muscles, hormones, enzymes, and many other functions. The issue is that a diet heavily focused on animal protein can affect several factors involved in stone formation. Higher animal protein intake is associated with changes in urinary calcium, uric acid, citrate, and urine acidity. This matters especially for people who form uric acid stones. Uric acid stones form more easily when urine is persistently acidic. So the correct message is not never eat protein. It is to maintain a balanced diet and avoid excessive intake of animal protein if your doctor identifies diet as an important contributor to your stones. Now here is a myth that deserves more attention. If your stone passed, you don't need to worry about prevention. Passing a stone solves the immediate obstruction. It does not necessarily solve the reason the stone formed. If you have formed one stone, you might form another. The risk becomes more important when stones keep returning. This is where stone analysis becomes valuable. If you pass a stone and your doctor retrieves it, the stone can sometimes be analyzed to determine its composition. That information gives your doctor a better starting point. For people with recurrent stones or higher risk features, doctors might also order blood tests and urine testing. A 24-hour urine collection provides information about substances such as calcium, oxalate, citrate, uric acid, sodium, and urine volume. Instead of guessing which food caused your stone, this testing helps identify your specific risk pattern. There is one more misconception worth clearing up. Kidney stones are not always caused by something you ate. Food is only one part of the picture. Kidney stone risk can involve genetics, body chemistry, certain medical conditions, medications, fluid intake, dietary patterns, and environmental factors. Some people have inherited conditions that increase stone formation. Others have medical conditions affecting calcium or uric acid metabolism. Certain medications also affect stone risk. This is why two people can eat similar diets and have completely different experiences with kidney stones. The prevention strategy needs to match the underlying risk. So what should you actually do if you have had a kidney stone? Start with the basics. Drink enough fluid throughout the day to maintain good urine output. Eat a balanced diet rather than eliminating entire food groups without a medical reason. Maintain an appropriate dietary calcium intake. Avoid excessive animal protein if your doctor identifies it as a contributor to your stone type or urine abnormalities. If you keep forming stones, ask about stone analysis and metabolic evaluation. Those steps provide much more useful information than trying one internet remedy after another. You should also know when a kidney stone needs medical attention. Seek prompt medical care if you have severe pain, fever, or chills, vomiting that prevents you from keeping fluids down, difficulty passing urine, or other symptoms that concern you. A blocked urinary tract combined with infection requires urgent medical assessment. And if your stones keep returning, do not settle for repeatedly treating each episode without asking why they keep forming. Your doctor can help identify the underlying risk and build a prevention plan around your results. The biggest kidney stone prevention mistake is thinking there is one universal rule for everyone. Calcium is not automatically the enemy. Lemon water is not a cure-all. You do not need to eliminate every food containing oxalate. And drinking enough fluid remains one of the most important foundations of prevention. The better approach is to understand your stone type, your urine chemistry, your diet, and your individual risk factors. When you know why your stones are forming, prevention becomes much more specific. This video is for educational purposes only and does not replace a consultation with a qualified doctor. If you found this helpful, subscribe for more clear and practical medical education. I'll see you in the next video.